Good, good morning, students. Today we have completed actually all the portions what is required for the exam. So we are supposed to do some 20 SDL topics, so which we have not done in the regular theory classes or in the previous classes. So we will complete this SDL topics and ECE topics in forthcoming classes and weeks. Okay. So today we will have SDL. The topic is, first one is drug-induced hemolytic anemia, and then vitamin D related bone disorders, respiratory distress syndrome. So these are the SDL topics. You have to write briefly about each of this topic. You have to write briefly on each of these topics. Maybe around 5 marks like question how you write, like that you should be able to write. The important points related to this topic you have to write. Like I will give you the outline how you have to write. For example, if you take drug-induced hemolytic anemia, what is this drug-induced hemolytic anemia? What is the enzyme deficiency which is responsible for this drug-induced hemolytic anemia? Enzyme deficiency which is responsible for drug-induced hemolytic anemia. And this enzyme is actually an enzyme of HMP pathway. So what is the role of HMP pathway? Specifically that enzyme in neutralization of the free radicals and mechanism of drug-induced hemolytic anemia. How the deficiency of this enzyme causes drug-induced hemolytic anemia. So under this heading you have to write. So I will tell you what is this enzyme deficiency responsible for drug-induced hemolytic anemia is. You all know it is an important enzyme of HMP pathway, that is glucose 6-phosphate dehydrogenase enzyme. Okay, glucose 6-phosphate dehydrogenase enzyme. It is an enzyme of HMP pathway. In the oxidative phase, we have two phases in HMP pathway. One is oxidative phase and non-oxidative phase. So this enzyme comes in the oxidative phase of HMP pathway, and this enzyme, very important point. Class Shruti in 10 minutes. Class. So this enzyme, this is a very important point you have to remember. What is this point is, this enzyme that is glucose 6-phosphate dehydrogenase enzyme, it is NADP dependent enzyme. This enzyme is NADP dependent enzyme, and it converts this NADP to NADPH. Okay? Understood? So this NADPH helps in the neutralization of free radicals. You know that pathway, how this glutathione peroxidase and production of this NADPH in this pathway, that is the oxidative phase of HMP pathway. So it gives you the overall picture actually how this HMP pathway plays an important role in the neutralization of this free radicals. If you remember, when we were talking about HMP pathway, I have written and shown you that hydrogen peroxide, which has the potential to get converted to free radical, but this hydrogen peroxide will be constantly formed in the body, that you cannot stop. The formation of hydrogen peroxide you cannot stop, but you can neutralize it to water using this enzyme glutathione peroxidase. Okay, so this glutathione peroxidase and the NADP dependent enzyme, this is an NADPH requiring enzyme. So this NADPH will get converted to NAD, and this NADP should be regenerated. So for the regeneration of utilized NADPH to, okay, so for the neutralization of free radicals, NADPH is utilized. Clear? I think I'm clear what I'm telling. For the neutralization of free radicals, NADPH is required. This NADPH, when it is utilized, it will get converted to NADP. This NADP will again converted back to NADPH in the HMP pathway by the enzyme glucose 6-phosphate dehydrogenase. I think if you go and read once HMP pathway and the neutralization of hydrogen peroxide, you can understand better. Since it is an SDL class, self-directed learning, you have to make effort to read and understand. That is why I'm just giving you the bird view how this happens. Okay, so you find out the answer and you write. What is the role of HMP pathway in neutralizing the free radicals is using NADPH. How this NADPH is regenerated by this enzyme glucose 6-phosphate dehydrogenase, you have to read. And how it causes destruction of the RBC membrane is that these drugs, some of the anti-malarial drugs, or not only anti-malarial drugs, any oxidative stress should be neutralized, or this free radicals should be neutralized. If they are not neutralized, it leads to RBC membrane destruction. So, especially you have studied about anti-malarial drugs which causes oxidative stress and causes hemolysis. That mechanism you have to learn how it causes the destruction of RBC and causes drug-induced hemolytic anemia. Okay, all people who are deficient, or this is a very common enzyme deficiency seen, and some are homozygous and some are heterozygous. Heterozygous people where only during oxidative stress they will experience hemolysis. Okay, so all these points you learn, you find out correct answer for these 3 headings and you have to write and submit it. Clear? So this is a one topic for SDL. The other one is vitamin D related bone disorders. So this, you all are very familiar with this disorder. What happens, see in case of this one also, what happens in this drug-induced hemolytic anemia, you have to write little bit about the laboratory findings, like what happens, increased hemolysis is there, so there is increase in the concentration of bilirubin, hemolysis is there, so anemia is seen, and there is important enzyme that is LDH, lactate dehydrogenase. It is an intracellular enzyme, especially in RBCs. It is present in high concentration as intracellular enzyme. Whenever there is a hemolysis, this LDH comes out and the concentration of LDH increases in the serum. So a few points like this, you have to find out some laboratory investigations. In case of drug-induced hemolytic anemia, you have to write. Okay, so note down that point. I have missed it here. Laboratory findings in case of drug-induced hemolytic anemia, you have to write. Otherwise, you will not get full marks if you don't write that part. Okay, laboratory findings. Okay, next we'll go to vitamin D related bone disorders. You all are very familiar with this vitamin D related bone disorders. what I want you to write in the beginning as an introduction is that first you have to write what is the role, why you are relating vitamin D with the bone. That is because what is the role of this vitamin D in the bone formation? So, in the bone formation, vitamin D causes mineralization of the bone is increased by increasing the osteoblasts. Okay, so these osteoblasts will take up calcium. With this vitamin D indirectly promotes the absorption of calcium. You know the mechanism. So it activates osteoblasts and remodeling of bone and mineralization of the bone. Briefly about how vitamin D helps in the bone formation, you have to write. And then you have to write different types of bone disorders related to vitamin D, that is rickets and osteomalacia. So first coming to osteomalacia seen in adults, what all you have to write with the rickets is first we'll go with the osteomalacia. So what you have to write is there is insufficient, this is seen mainly in adults, there is insufficient mineralization of the bone, increased osteoporosis is seen. Because of osteoporosis and decreased mineralization, they are prone for fractures, and there is slight decrease in the concentration of serum calcium, and this decreased serum calcium is there, but it is not sufficient enough to cause tetany. That is why in case of vitamin D deficiency, tetany is not seen. Hypocalcemia and hypophosphatemia is seen, but it does not cause tetany. So to cause tetany, the serum calcium level may go to 6 or 5, to that low level. But here what happens is the serum calcium level is low, but not very low to cause tetany. That you have to write. So first you write about osteomalacia. What are the clinical features? Where do you see this? Coming to the rickets seen in children. So what are the different types of rickets? You know, vitamin D resistant rickets are there, hypophosphatemic rickets is there, and Fanconi syndrome. Fanconi syndrome is a renal disease. What happens where there is the renal tubular defective reabsorption of bicarbonates, phosphates, glucose, amino acids are defective. So that is called as vitamin D resistant rickets. Vitamin D is there, but still there is a rickets because there is increased excretion of all these compounds in the urine. So that is also called as Fanconi syndrome, where there is defective renal tubular reabsorption of bicarbonate, phosphates, calcium, amino acids, all those things. And we have got hypophosphatemic rickets, like how calcium is important for the mineralization of the bone. In the same way, phosphate is also important in the mineralization of the bone. So hypophosphatemia can also cause rickets. So there are different types of rickets. Renal rickets is there, end organ rarefaction rickets is there. All that rickets, you read what is this renal rickets, how calcitriol formation is affected in rickets, why the active form of vitamin D is not formed in case of rickets. All those things you read, and then you write. Coming to the clinical manifestations in case of rickets, lots are there. The x-ray, this thing findings, the bow legs, and then rickety rosary, Harrison circus, that is depression in the in the costochondral junction, beaded appearance in the sternal junction, costosternal junction. All those clinical manifestations of rickets you have to write, and how to treat that vitamin D deficiency rickets, everything you have to write. So this is about vitamin D related bone disorders. Okay. Next we'll go Go to the other important, the respiratory distress syndrome. Respiratory distress syndrome. What is respiratory distress syndrome? If a person or a baby cannot breathe on its own properly, then you call it as a respiratory distress syndrome. What are the types of respiratory distress syndrome? Acute respiratory distress syndrome, commonly seen in adults, and also neonatal respiratory distress syndrome. So more we will focus on neonatal respiratory distress syndrome. So what happens in case of neonatal respiratory distress syndrome is that it is a breathing disorder. Respiratory distress syndrome is a breathing disorder. It is commonly seen. What I'm talking is neonates now. Preterm babies. It is commonly seen in preterm babies. So if the babies are born before 37 weeks of gestation, they are vulnerable for this numerous complications like infections and respiratory distress syndrome. What happens here is if they are born before the 37 weeks of gestation is the lung maturity is not proper. That is because surfactant, you all know about the surfactant, that is dipalmityl lecithin, or it is also called as surfactant. Respiratory distress syndrome neonates, it is also called as hyaline membrane disease. It is also called as hyaline membrane disease. So the pulmonary surfactant is deficient. What is the function of this pulmonary surfactant is it coats the alveoli and prevents the collapsing, especially during expiration. During expiration, when all the air comes out, the lungs collapse and it cannot reinflate. So in the presence of this surfactant, this dipalmityl lecithin, it does not allow the lung to collapse. Okay, so that is the function of this surfactant. So the how to diagnose this respiratory distress syndrome prenatally is amniocentesis. You can analyze the sphingomyelin lecithin ratio. You can find out. That is self-directed learning. Again, you find out the points how to diagnose respiratory diagnosis preterm, all using amniocentesis. All those things you find out and you write. So for today's SDL topic is now drug-induced hemolytic anemia. I have given you just the brief account of what is this drug-induced hemolytic anemia, vitamin D related bone disorder, and respiratory distress syndrome. You have to find out important cream of points you have to find out, and then you have to put it. Don't write elaborate answers. Briefly you have to write. Okay, so this is about today's self-directed learning class. Okay, thank you, students. Sunil.